So my name is Jill Penman. I'm a physical medicine and rehabilitation doctor, and I'm the medical director of the pain navigation services at IU. So people with osteopetrosis, of course, are at more higher risk for getting fractures. So a fracture hurts, and that causes what we would call acute pain, which is pain that happens as a result of an injury and lasts is supposedly a short duration of time, which would be less than 3 months. So fracture pain is a definite possibility. The other thing that can happen is there can be some extra bone growth around where nerves exit, because nerves kind of like to live in little divots of our bones where they leave and go into our limbs, our head and neck, and all over our body. And so if there's extra growth, that can irritate a nerve or it can compress the nerve, so then you can get nerve pain, which might feel a little different than fracture pain. That is more like burning, tingling type of sensation, can sometimes have some numbness or even weakness associated with it. When pain becomes chronic is when it lasts more than 3 months. We consider that to be chronic pain. And at that point, there's something different that's going on in the body that's not happening in acute pain. And for that reason, we treat it differently. So when pain becomes chronic, what that indicates is a lot of times the tissue might have healed, the fracture might have healed, maybe if there was a nerve injury that might have healed, that maybe would take a little bit longer than 3 months. But if the pain persists or the pain worsens, then we would call that chronic pain. The way that our brain and spinal cord work starts to be different to help the pain persist. So we treat that a lot differently than we do acute pain. We use totally different medicines for it. And we use a lot more of the mind-body approaches to treat that type of pain. So one of the key things is movement. So staying active, doing what kind of movement you like to do and what feels good in your body. With osteopetrosis, if you're worried about not wanting to build bone density as much, you would want to focus on low impact movements. So things like water exercise maybe, or we call it zone 2 cardio, which is getting your heart rate in that zone that's about 70% of your maximum heart rate. That's really good for pain in the long term. It increases our pain threshold so that your body will be less sensitive to some of those painful things over time. The other thing that's important with lifestyle is sleep. Sleep is a huge deal. That's usually one of the first priorities, because I tell my patients, if you can't improve your sleep, it will be very difficult to heal from chronic pain. We need that deep sleep, the stage 3 restorative sleep, for our tissues to heal, our muscles, tendons, and bones to heal, our immune system to work properly. So making sure we're focusing on that and getting a good quality and restorative sleep as well as enough sleep is a huge deal. And the last thing I think is stress management. We can't really make stress go away in our lives, so we got to find ways to just kind of manage it to help process our emotions, because when we don't do that and when we kind of just push through all the time, things can kind of build up and that can lead to pain flares. So that is the part that I think looks different for everybody, in addition to some of the medicines that might be helpful. But that can be things like mindfulness, expressive writing has really good evidence in chronic pain, working with a pain psychologist, anything like that to help manage stress long term. My other tip would be always have a plan for a pain flare, because they're going to happen. They're part of life. We're all going to get injuries, and with this condition, you're at more risk for developing injuries. So I'll give some suggestions for a good plan for a pain flare. I would have that include medications. So that can be like over-the-counter stuff. We know that from research, it's hard to believe, but ibuprofen with Tylenol at the same time is as effective as an opioid medication for an acute pain. So having little tricks in your tool belt like that. Maybe your doctor's prescribed you something that you can use during a flare, like a muscle relaxer or a stronger pain medication. So having those things on hand. The other thing to have is a plan for movement. So even when you're in pain, kind of just have something really simple that you already know that you can do, like going for a 5-minute walk, just to get the blood flowing, get your body moving. I'm big on modalities. So what I mean by that is things like a TENS unit, which is little sticky pads that you hook up to some wires and they stimulate some of the nerves. You can get those on Amazon for $30 or $40, and they block some of the pain signals coming in, so they're great for short-term pain relief. Heat and ice can be really helpful. Heat is going to increase that blood flow and promote healing. Ice is going to numb the nerves, so whatever works best for you in the moment. And then I like things like kinesio tape, or sometimes some bracing can be helpful to work through a pain flare. So working on movement, having the right medicines and modalities, and then also having something or some kind of practice that you know works for you to manage your stress. So maybe you do an expressive writing exercise, maybe you have an app that you like to do a mindfulness exercise when you get a flare. But my main point is you have to actually write this down, because what happens when you get in that pain flare is your prefrontal cortex goes offline and you lose access to that executive planning and to your ability to kind of problem solve. So you want to have something you can go to that you know works for you.